What's up, everybody? This is the third video documenting my scapholunate ligament repair and reconstruction. Just to start this off, I will be very honest. I did not give this procedure and this recovery, this whole process, I did not give this its proper due. This is much more than you would think it would be for such a small ligament, such a small joint, such a small area of the body. But this is a pretty involved and pretty kind of I'm not gonna say it's a little bit intense only when you put all the factors together, and I'll talk about that a little bit. So today is 1 week post-op. I had my surgery last Friday on the 14th. Today is the 21st, and I had my first follow-up appointment yesterday. So if you saw in the last video, I talked about that I had a drain tube in here. And so they removed that, just kind of changed the dressing, cleaned it up a little bit, and then wrapped it back up. I was able to snap a couple pictures, and I also have the picture of the x-ray that they took yesterday just to make sure that everything was kind of moving along nicely. So overall, the doctor is you know, they are happy with what it is, with how it's looking. The doctor did say she was hoping it'd be a little bit less swollen. So if I could say one thing, it would be to really make sure that you elevate, really keep that hand up at all times. Actually, what's happened is when I was in the house, I wasn't really wearing the arm sling as much. I know it's off right now, but I just walked back in the house. I've had it on all day. So I wasn't really wearing it in the house, but I was walking around with my arm like this. And so now what's happened is, now that I have all the feeling back everywhere, I'm feeling it much more in this area here. These muscles are kind of contracting all day. I'm using them all day, holding my arm up like this. And so now I feel like I've done about 1,000 push-ups in this area of my body here. But really it's just from holding my arm up. So I have been wearing the sling the last couple of days, kind of everywhere in the house if I go out, just to really take the pressure off this area here. But then what happens if you wear the sling too long, it starts to put the pressure on this area over here, right? Because your arm is kind of, your arm is weighed down. This thing, the splint here, it's heavy. So so I had my first follow-up yesterday. They removed the drain tube. The scar is much bigger than I expected. It probably covers about, I'm gonna say this much. So you're talking probably about 4 or 5 inch scar. It's pretty big. And then also too, here on the inside, there would be kind of here, and then here. I have 3 incisions. This one I knew he was going to take a tendon to use for the reconstruction of the ligaments here with the anchors. So I'm not sure exactly what these are. And these are, I saw the doctor's nurse practitioner yesterday. So I didn't get a chance to ask, but I will ask at my next follow-up why there are these extra 2 incisions here. So all in all, I have the scar. I got 1 incision, 2 incisions, 3 incisions, and then right about here, this area here is where the drain tube was. And so that's a little wound in itself that's got to heal. So I'll put some pictures at the end of the video. You kind of see what it's looking like. But overall, I would say that this is much more involved than I thought it was going to be. The pain last week was mostly, now that the pain has shifted, it feels different. The pain last week was more so all the swelling setting in. And I think that's what all that pressure and deep throbbing was that I talked about, that I felt last week, was just all that pressure and everything. I still do have some swelling. My fingers have gone down significantly since the last one. You can see my knuckles a little bit more, but I would say in here is still some numbness, some tingling, and some swelling. And then down here, hand, top of the wrist is still fairly swollen. So the pain has now shifted. Now that the swelling is kind of where it's going to be, I don't think it's going to swell up anymore. Now that the swelling is where it's going to be, the pain has now shifted to the hardware that is in the wrist. So in the wrist I talked about was going to be a pin. There's actually 2 pins. There's actually 2 pins in the wrist, and they are, I'll kind of pick the phone up for a second. They're going to be right here on the side, kind of just below my thumb, kind of just below the thumb area. So you're talking about probably like right here, kind of like they're kind of two pins right on top of each other. You can see the incisions. They're kind of like one here. And so what happens is one pin is going, the pin on top is going through the scaphoid bone. So remember we talked about in the last video, the scaphoid bone is kind of like a longer peanut-shaped bone, and then you have the lunate bone, which is here at the bottom next to it, and then you have another bone on top over here. I don't know what that one is called. But so what they did with the top pin is they put that through the scaphoid down into the lunate, and then the other one went in the same entry point, looks like, for the most part. So they kind of make a crisscross through the scaphoid bone up into the bone that's above the lunate bone. So it kind of creates like a little lock, a little anchor, and I'm definitely feeling that. I feel it. It's kind of like a deep bone pressure, and it's like radiating from the point of the entry kind of down the inside of my forearm, down this way, and down and around this way. I definitely feel in this whole area right here, I definitely feel a lot of pressure, a lot of if I move my arm a certain way, it's almost like I can feel the pins kind of locking, and I feel that against the bone. And so it's a different kind of pain. Unfortunately, it is still a constant pain. So this is now, day 7, that it's just a pretty constant pain between the previous swelling that was going on, that deep pressure pain that I was talking about, to now this kind of a little bit more on the surface bone pain. We're talking about a week straight of just pain and discomfort. So it's been a tough week. It's been a tough week. This is definitely more than I bargained for. This is definitely more than I gave it credit for. I was not ready for what all this entails. So that being said, I have my next week follow-up where I will be getting the stitches taken out and the cast will go on. So the doctor said that if the swelling still hasn't gone down much more, obviously they're gonna have to make the cast a little bit looser than they would normally. If it's to a point that they don't really feel it would be effective, then they're actually going to hold off putting the cast on. So hopefully I can kind of just I think the more I can move my fingers, now I have this, now that a lot of the swelling has gone down, I can move my fingers a lot more. I have a lot more range of motion. I can kind of get up here and do a little bit of a stretch without feeling it too much in the area where the scar is. It's not too bad. I could even kind of get my fingers a little bit on the back side, but I start to feel a big pull in this area over here if I do that. So I don't do too much, but I think if I can keep moving my fingers a little bit more, I can get some of the swelling down here, byproduct, get some of it down, and kind of keep it going down. But I'm just going to really keep my hand elevated. I think this really speaks to, in that first week from the day of the procedure on, just wear it. If you're sitting down, you can take it off and just make sure your arm is up. And if you're going to be up and around, just really wear it to make sure you take the pressure off the rest of your arm, but also that you're just letting that blood just kind of flow out. So as it is scheduled, I'm supposed to get the stitches out next week and get the cast on. They were pretty confident that they'll still be able to put the cast on. And then from there, we're talking about 6 to 8 weeks of having the hard cast on with an X-ray in between where they're going to take it off and do another X-ray, recast it for the last 2 or 3 weeks or whatever. So all in all, I am still moving in a positive direction. It is just a lot more than I think I had planned for, even what I had seen in other videos and people's personal stories. So this is definitely something to be prepared for, that especially depending on the kind of work you do. Just comfort wise, you might be out of work for a little bit if you have to have this done, because obviously it's not an injury that prevents me from being up, right? It's not my legs, my knees, my hip, my back, anything like that. But The pain is to a point. I'll say more the discomfort is to a point where you really just don't, you just want to sit down. Like it's just constantly hurting. It's kind of radiating down my arm. It's going into my elbow a little bit sometimes. My arm gets very tired from having to hold it like this all the time. Or my neck is very sore from it being in the sling and, really pressing on these muscles all back here. So I'm still not sleeping very well just because I'm very aware of it. I'm nervous if it starts to slide off of the pillow. I did try to sleep in my bed last night, but I didn't get a very good night's sleep because, when you sleep on the couch, you have the back of the couch to hold it here, to support it this side, and then you can kind of put a pillow here. So if it does fall off, it's going to fall into the back of the couch. But when I'm on my bed, it started to slide a couple times and it would just, kind of go down. And so I was very aware all night. The pain was still there. I did have to take something in the middle of the night. So I'm pretty steady still on the ibuprofen and Tylenol. I think that's going to have to be for the next couple of weeks because it's almost like I feel the pins locking the joint in place. Like this thing is not moving for the next couple of months. And I feel it kind of stiffening up. So I think just to kind of to alleviate some of the pain, I am gonna just kind of stick on the ibuprofen and Tylenol, and hopefully that kind of keeps me ahead of it a little bit. And just as the weeks go by, I'm really hoping that the pain, you just kind of almost get numb to the pain a little bit, that it does go away as it settles in. I think that I do have to remind myself that this still is only 1 week post-op. So it's not like we're talking a month past. So all the wounds are still very new. All the holes that were drilled in the bones are all still very new. So the trauma to the area is still very new. So I am keeping that in mind. So, but I'm just really hopeful that by this time next week, I will still feel, that I will still feel a little bit better. Initially I was going to only be out of work 2 weeks. But after yesterday's appointment, she actually put me out for an additional week because the swelling still isn't really down that much, and just the discomfort, the pain and discomfort. This is a lot more than I thought was going to be, and just the nature of my job. I have to be up and around and kind of able-bodied. So I have, like I said, my follow-up to get the cast on is next Friday. I'm excited about that. I'm really anxious to get to that part because that's the longest part of all of this. And then, because once the cast is off, the pins can come out and I can start the rehab. I can start the therapy, the PT and everything. So I will share that experience, kind of getting the stitches out, getting the cast put on, and just, keeping you guys updated and informed. So just, if this is something like I keep saying, if this is something that you have to get done, or thinking about getting done, although the initial recovery is tough, it is difficult, I would advise for it just because of the prolonged health risks if you don't do it, to your joints and your bones. So I'll do another video in about a week when I'm getting the cast put on. All right, until then, if you see this, share it, send it to people that going through the same thing. Hopefully it's helpful. All right, I'll see you guys soon.